Every job ad at the moment says great supervision and amazing professional development opportunities. But what really is good supervision and good PD? We're going to have a look at that today and what MoveAbout thinks that means. Hi and welcome to the MoveAbout channel. I'm Dave Jerub, owner of MoveAbout Therapy Services and creator of the MoveAbout activity cards. Today I'm sitting on, Copa Beach, close to Copa Beach, halfway towards Max. We've got Max in the background. I'm not far from the dog park, so we could get some visitors. Today I want to chat about what really is good supervision and what is good PD in a Paediatric Occupational Therapy practice. So I'm going to talk about what we offer, and I'd love to invite discussion about what you guys offer at your place and what you think good supervision and good PD is. So firstly, supervision to me is not something, it's a whole different bunch of ways that people do this. One of our more recent team members got supervision once a quarter, every school holidays. To me, that was mind-blowing. Our guys get weekly supervision for an hour with a more experienced therapist. Now that hour is also not one size fits all. So, we have training in supervision and how to provide that, but there are different needs for a new grad or a more early years therapist than there are for a more experienced therapist. In the early years, we need to show and teach and tell and give the opportunity to practice. In the later years, we need to switch more to, or actually in our clinic, quite quickly over the first couple of years, we're switching to reflective mode, where we're really getting therapists to be self-reflective and to think through that process, to think about what they're bringing to the session and what the session's bringing to their practice and how they can learn from other times and other sessions in their life. So everyone gets weekly supervision. That is something that is not negotiable, not something that we move or change. That is the most important part of your week. There's also a lot of informal supervision that happens in terms of when you get to work with 6 or 7 other OTs in the same practice, when you get to share a treatment place. There's a lot of learning by osmosis. There's a lot of sharing ideas, seeing other people's ideas. That's a really powerful way to earn, but also informal supervision or impromptu supervision, where something comes up, you're able to book in with either myself or one of the senior therapists just to check in around a particular topic. And so we make sure that we have time to be available for that. We also have time to jump in sessions and coach or problem solve or support parents while you're working with the kids, or support you to work with the kids. And there's different strategies, again, based on where your skill level is, as to whether we're providing strategies, we're coaching you through it, we're supporting the families, or we're modeling things for you. But we can come in and help problem solve. And that's not something that at our clinic makes you look like a novice. It's something that families really appreciate because they know that they have a whole team supporting them. So you don't have to pretend. You don't have to act like you know everything. You don't have to fake it. You just have to say, hey, that's a good question. Let me run that by the team. Let me run it by Dave. Let me get Dave to jump in and have a look and see if we can brainstorm some ideas. And families really appreciate that. Beyond weekly formal supervision, we also have, and all this informal things and jumping into sessions and learning by osmosis, we also have group supervision as well. So particularly in the early years, we have our intro to MoveAbout training, where we run through some of the real basics of what it means to be a MoveAbout therapist and to be able to practice the way that we do. We also do video case studies together as a group, so that's also a really great way to learn through reflection and learn through other people's reflection. When you're starting, the initial process is you're greeted with several emails helping you prepare to know what to wear, what to do, where local facilities are around the area where you can get food, where the bank is. You've got all that before you arrive, and then on day one you get a welcome pack that welcomes you to MoveAbout and runs you through your first day. It also provides you with a document that we call our 0 to 100, where you have, here are the things that you'll get to learn in the first 100 days, and there are videos to support that, and then you'll have access to the team to be able to ask any questions around that as well. So it's very structured, so you know exactly what the expectations are, and some really great learning opportunities to be able to learn how to be a MoveAbouter. Also beyond those for supervision and merging into PD is We have a lot of great contacts in the US and Canada. Some of those I've been lucky enough to come across in my work. Some of those I've approached at conferences and asked if I could pay them to do some support with us, but we often do reflective supervision or case-based supervision with some great professionals who we pay to spend the lunch break with us to do an hour or two, either looking around topics. So we've had Kim Barthel do a Kim Unplugged section where we send her 5 questions that are important to us and relate to her area of expertise, and she reflects on those with us and we have a discussion. We also are doing a series of case-based supervisions with Tracy Stackhouse at the moment around the STEP SI model, which, stay tuned, Sensory Tools will be offering in the new year, and I'll be teaching that with Tracy. So we have that's moving supervision into PD with those opportunities. When you start with us, you get to sit in sessions for 10 to 15 hours a week for the first few months and just absorb and observe what's happening. We get you to think critically about what the activities are, what you're learning, how you could grade them, who you could apply them to. So that ability to just be with a mix of therapists and see people work and reflect on it is super powerful. We do have a PD budget, and so we do support people to do PD that they can have their passion PD that we say is 1,000. I always go over that with people. Beyond that though, if people see a good training, they tell me that we organize it, and I often just get that person to do the training for our team. So, and there are particular MoveAbout things, a whole bunch of things that you really need as a MoveAbouter, that doesn't come out of your passion PD. So things like therapeutic listening, the brushing TheraPressure program, the STEP SI program, the traffic jam course, the MORE course, the astronaut training. There are a whole bunch of courses that everyone has at our practice, and so that's not something that comes out of your professional development budget. If that's available to us in our time zone and you haven't done it, then I allow you to go and do that particular training, as well as getting into DIR floor time. There's a whole bunch of areas of direction. PD is the most important in our practice, and people who feel in control of their sessions, people who feel competent in what they do, and people who can really feel like they excel in what they're great at and they can work in their zone of genius, they're the people that are energized to support our families and to support our practice. So for us, PD is everything. Supervision and support is everything. It does go beyond the clinical. We have a lot of areas where we're supporting team members in terms of group connection and culture, but today I just wanted to chat about supervision and professional development, and they're the things that are going on at our practice. I'd love to hear what's going on at your practice. I'd love to hear of any things or any ideas or things that you guys are doing that we could incorporate at our practice, and feel free to show this to your boss and get them to offer you more PD, or if you're looking for another opportunity, check out our careers page on our website and reach out to us, even if you just want to have a conversation about life at MoveAbout and introduce yourself. That'd be great. It'd be great to see you then. So that's the end of our discussion on supervision and PD. Please leave some comments in the discussion below. I'd love to hear what happens at your place. I'd love to hear any questions that you have or any discussion topics you have. And don't forget to hit that red subscribe button. I believe it's somewhere down there. And if you hit subscribe, then you won't miss out on any of our videos. All right, I'll see you next time.